When is closed sinus lift indicated? In cases where the jawbone lacks sufficient height for implant placement, the doctor will perform a closed sinus lift. This involves carefully drilling through the alveolar ridge at the missing tooth site and using a specialized drill to detach a small piece of bone, typically circular or oval in shape. Bone graft material is then placed into the created space to achieve the desired sinus lift height. Once the sinus membrane is properly elevated and the bone graft is in place, the implant can often be inserted in the same surgical session. The closed sinus lift is a minimally invasive, supportive procedure that helps the implant surgery proceed quickly, safely, and effectively, while significantly reducing the risk of complications. Closed sinus lift. This technique is typically applied for cases where the residual bone height ranges from 4 to 8 mm. It is most suitable when the sinus floor anatomy is favorable and there are no signs of sinus pathology such as sinusitis, sinus adhesions, or membrane thickening. The closed sinus lift supports the success of implant surgery by optimizing bone volume, improving implant stability, and enhancing long-term treatment outcomes. Closed sinus lift procedure. Gingival tissue is carefully opened to expose the targeted area of the maxillary bone. A small hole is drilled through the cortical bone at the implant site. The sinus membrane is gently lifted using specialized sinus elevation tools. Bone graft material, usually synthetic or xenograft, is placed into the created space beneath the elevated sinus floor. In many cases, the implant can be placed simultaneously with the sinus lift procedure. The surgical wound is carefully sutured to ensure proper healing. Advantages: minimally invasive technique, reducing postoperative swelling and pain. Shorter recovery time compared to open sinus lift. Limitations: requires high surgical skill and precision to ensure safe elevation of the sinus membrane. Improper technique could result in sinus membrane perforation or insufficient lift, which may compromise implant stability.